Okay, so I think we're gonna get started. Um, Hopefully everyone can hear me. So my name's Julianne Trudeau, and between myself and Nicole Collins, who we also have here, we're going to be talking about collaboration with your service providers. So understanding ABA, which is applied behavior analysis, speech and occupational therapy. We really want this presentation to be as interactive as possible. So if anyone has any questions at any time, or anything that you want to add throughout the presentation, please feel free to type it in the chat, and we are happy to answer them. Before we get going into some of our objectives, I just figured we could do a little introduction. So I'm Julianne, like I said. I'm the director of speech services for Bierman Autism Centers. So I oversee all 17 of our centers with our SLPs. I've been an SLP for almost 12 years, mostly in pediatrics. And I've been with Bierman since October 2021. And then Nicole, if you want to do an introduction too.
Okay, so I'm Nicole. I'm a BCBA here at Bierman. I'm located in Arizona. I've been a BCBA for just over 2 years, but I've worked with kids for over 20 years with a whole wide range, like with early education, social work, that kind of stuff. But yeah.
Okay. So some of our training objectives tonight, we want to provide an overview of applied behavior analysis, an overview of speech therapy. If you see SLP, that's just speech language pathology. It's synonymous with speech therapy. Overview of occupational therapy, and then discuss the collaboration amongst all of those providers. And Nicole, take it away.
All right, so I'll be talking about ABA, or applied behavior analysis. So that is one of the main services we provide here at Bierman, along with the other two that we'll talk about. But essentially, this is really big about behind science. So we're looking at how and why, kind of understanding that why behind behavior. And typically it doesn't even have to be just humans, it could be animals as well that we're looking at. And a big question is, what is behavior actually? So essentially it's anything that you do, your child does, is considered behavior. So as a behavior analyst, we really like to objectively define, so something that 2 or more people can agree if it happens or does not happen, and looking at teaching behavior that has that socially significant change. So actually something that will really impact and make that difference for clients and their families. So I guess really in a nutshell, we are really looking at identifying some of those, deficits, what's going to really impact the family, what's going to really increase that independence for your children and everything. And when we look at socially significant, we really want to improve that overall life experience for the family in itself as a dynamic. We really want to look at how to learn and how and why that someone behaves the way they do, and then work with them in that environment to improve it. So a big thing with me is I like this little saying that is, it talks about a plant. When a plant is dying, we don't try to change that plant. We change the environment in which it's growing to really thrive. We can do the next slide. Okay, so now we're going to look at how ABA can be used to target different areas. So these are the different kind of main developmental domains that we look at. We have the communication, which that can be something that we look at not just vocally, but we look at gestures. We look at the use of devices, sign language, pictures. We also look at social behavior. So this is something such as greetings, that hello, goodbye, the eye contact, how they respond to their peers or others, and any of those requests that they make to their peers. And then we have toilet training. That's a really big one with families, especially with that early intervention. So we look at some of those prerequisite skills. So some of those skills leading up to toilet training. So this can be dressing skills. This could be washing hands, even just learning to sit for a long period of time, or, a set period of time, essentially. And then we also want to look at the play behavior. So functional play, are they using a toy as it's intended? Independent play, can they play by themselves or do they need someone there with them always? Like we're working on building that independence that they can be able to interact on their own, as well as pretend play. So kind of pushing that envelope further, bringing that creativity and using toys or even objects in ways that they're not intended, like, flipping over a bowl and being able to pound it like a little drum. Then we also look at independent skills. So this is going to be a lot of self-help skills, such as hand washing, daily routines, such as eating, some of those eating skills. And then we also have tolerations of non-preferred tasks. So this is probably one of the big things we work with because, I know one of the main reasons families come is like, hey, we need to help like our kids having tantrums and everything. And typically it is some of these non-preferred tasks. So we look at, okay, how can we increase cleaning up or those transitions between high to low preferred activities, even waiting. That's a big thing that, us as, families and parents is that we have to work on waiting, that we're not always available. So we also look at focusing on those skills as well.
Okay, so now we're going to talk about some speech therapy services. So what is speech therapy? A lot of times I've found over the years that people hear speech therapy and their, first reaction is, oh, great, you're going to help my child talk, which yes, we are, but there's a whole lot of other things that we can work on. So speech therapy in general is the assessment and treatment of communication, language, and speech disorders, as well as pragmatics, social skills, AAC, which is augmentative and alternative communication, which can be a high-tech device, but could also be sign language, gestures, a communication board, and then feeding and swallowing disorders as well. So some of the areas that we focus a little bit more of in terms of speech therapy when we're looking at pediatrics are also some of the things that Nicole mentioned in the ABA overview. So social language, greetings, commenting, body language, receptive language, which is your understanding. So following directions, identifying objects, places, people, understanding different questions that they're being asked, who, what, where, and then expressive language, which is their vocabulary, their grammar, their sentence structure, as well as some of their articulation, which is how we actually pronounce different sounds. Some of the common goals that we see, because there's a lot of overlap between speech language pathology and what BCBAs work on. So vocal imitation, requesting, or what you might hear as manding from an ABA side, using AAC, language acquisition, following directions, and feeding. When it comes to occupational therapy services, so specifically one of the biggest areas when Nicole was talking about what ABA tends to target, that independence, so those activities of daily living and those just independent skills for daily routines, that's a lot of what our occupational therapists will cover. So what is occupational therapy? An occupation is any activity that occupies your time. Application is when a diagnosis or injury prevents you from meaningfully engaging with your daily occupations. And so what our OTs can do is help in allowing our kiddos to participate in those activities. The bigger focuses for OT in terms of pediatrics: play, so puzzles, cause and effect, ball play, climbing, swinging, eating, so oral motor skills, fine motor, tolerating different food consistencies or textures, using utensils independently, education, so that would include things like handwriting, drawing, scissors, gluing, and then hygiene, so bathing, brushing teeth, and dressing. When it comes to different motor skills, there's 3 larger areas that our OTs will typically work on. So there's fine motor, which is more of those smaller types of movements. So buttoning a button, zippering, being able to lace your shoes. Gross motor is more of those larger muscle movements. And then visual motor is more of that like hand-eye coordination type of connection. Some common goals that we see amongst occupational therapy and BCBAs: gross motor imitation, fine motor imitation, play skills, feeding, and then those daily living skills: brushing your teeth, tying your shoes, zipping up your coat, OT will work on the skill itself, and a BCBA may work on tolerating and interfering behaviors during those tasks. So Bierman has always had a very heavy focus on collaboration with speech and OT. I've been really fortunate to work with fantastic ABA providers in the past. I know that's not always every SLP or every OT's story, but I think Bierman does a really great job of making sure that we have opportunities for collaboration, that we're really working closely with one another. And, you know, we may look at things from two different lenses, but we have the same goal in mind at the end. So in terms of OT and speech services, we utilize two models. Your first is your direct service. So that's your typical one-to-one. The SLP or the OT would work with your child. We perform an initial assessment, sometimes using a standardized assessment, sometimes not, because some of our kiddos just, you know, that's not for them, and that's fine. We'll come up with some goals in collaboration with the family, and we'll typically recommend a frequency. Usually it's 1 to 2 times a week, anywhere from 30 to 60 minutes, depending on clinical judgment, also depending on what insurance allows us, unfortunately. And that's billable services, again, that one-to-one. Sometimes it's a push in where we might see them in their room. Sometimes it's a pull out where we might see them in a separate space with that OT or that SLP. And we're also able to provide more of a consultation model. So what that looks like is the OT or the speech language pathologist would go into a session with the BCBA and maybe have them run through some programs. They might ask for our feedback. So from a speech perspective, it might be, hey, I'm doing this ECOICS program, which is a vocal imitation type of program. Am I starting with the right sounds? Or they can do this sound, but I'm trying to progress it. What should I do? Or, hey, they have, you know, this AAC device. I have no idea where to start with it, how to implement it. And so what we do is we're right there to watch them run through some of these programs and provide our feedback and suggestions. And that's a non-billable service on the speech and OT side. And then we can also overlap in sessions to help problem solve and just overall support their therapy. So we're all kind of on the same page, and vice versa. I mean, I've constantly asked my BCBAs for help managing behaviors while I'm in a session working on speech and language. So it's very much a back and forth. So the collaboration is a couple different ways it can look like. The vocal imitation goal I kind of just mentioned. So the SLP may help identify what's developmentally appropriate for the child, and the BCBA will identify how to target the behavior and train the team. If it was something on the OT side, like a fine motor imitation goal, so the occupational therapist is going to assist in coming up with the most appropriate targets based on the child's development, the correct hand positioning. And then again, the BCBA is going to identify how to teach those targets, best way to prompt and train the team. So the overall goal is to collaborate to promote the most success for our learners. And we do that by having meetings together. We're constantly chatting back and forth to make sure, you know, if there's any updates to anything, that we're keeping the other informed. Feeding goal. So an OT could assist in identifying appropriate seating position, gripping of utensils. SLP could assist with chewing different oral motor exercises. And again, the BCBA assists with tolerating foods and sitting at the table, that overall behavior that they have the expertise in. And then lastly, there's AAC goals, which we see a lot of. So we may collaborate on the use of the device throughout the day and how to get the most out of that through their ABA sessions. And the SLP would assist in determining what's the best device for them. Can they get it from insurance? What grid size do we want to start with? How do we want to prompt them? All of those things. So some key takeaways. If you are a Bierman client, you would be eligible for these services, speech and OT, obviously ABA. And we would work with our insurance team to figure out getting that set up. Unfortunately, we do not have an SLP and an OT in all of our centers. Some of our newer centers may have an OT, but not an SLP. Some of our centers that have been around for a while do have both. We're actively working on hiring. It's just the kind of way of the world right now and our difficulty in finding some staff. But luckily, we do have myself as the director of speech, and we also have Maeve London, who's our director of OT, who is equally as wonderful. And so we are able to provide that support and some virtual consults for our centers where we're still looking to staff. And then the fact that BCBAs, SLPs, and OTs working together is going to ensure that the most progress is made. I feel really fortunate to be in a center that is able to provide those in-house speech and OT services, because not every ABA center out there has that luxury. And I feel like it really does look at that whole picture of our kiddos and really give them the most beneficial types of treatment that we can. And that's all we have. So we'd love to open it up to questions, comments, anything anyone has. Sensory, yes. Great question, Hope. So sensory typically will fall under the occupational therapist, and we do see a lot of it. And it will impact everybody, because depending on whether the child is sensory seeking, or maybe they're trying to avoid some of those sensory types of behaviors, they're not going to be able to get the most out of their ABA or the most out of their speech therapy sessions until we can help to regulate them. So whether it's using like a vest or like giving them some compression or some squeezes to help kind of bring their attention back. We use things like wiggle seats to help kind of regulate their sensory system. We'll use fidgets. We have different peanut balls and exercise balls that we'll use. And that's something that's really helpful. Regulation, yes, I can try to. And OT would do a much better job, but I'm going to do my best. So let's say you are someone who in a grocery store on a Saturday afternoon, you're, just trying to push your cart and get your food and get out. And there's bright lights, there's lots of people, there's screaming kids, there's dinging of the register, there's people who work there who are stocking shelves. There's just so much going on auditorily, visually. You feel really overstimulated, or you may feel really overstimulated. That's what a lot of our kiddos feel in one way or another. What our occupational therapist will do is look at all the different senses in their body and see if they can determine, like, okay, they get more overstimulated from auditory feedback. They get more overstimulated from tactile pressure. So what we try to do is give them strategies in order to bring their system back down and kind of regulate and calm it, so that they can take in whatever, we're trying to do with them in that moment. So the example of the grocery store, if I was going to try to like regulate, if I was feeling really overstimulated, I might put headphones in to kind of at least block out the noise. I might put sunglasses on, as weird as that's going to look, to help with the fluorescent lighting. So exactly, regulated equals homeostasis. So like if you're at the beach and you're sweating, what do you do to regulate your body temperature? You might jump in the water. So that's essentially what we're trying to do with our kiddos, to help regulate and bring their system back so that they can be an optimal learner in whatever we're trying to teach them. That's a great comparison. You're welcome. Yes, OT. Okay, dealing with that. Ray, I think you were at my last webinar. Good to see you again. We're dealing with the feeding issue in a major way. Currently have an SLP who's working with our ABA team, as well as a dietitian. Next step is adding an OT. My son is barely eating any foods recently. It's really challenging. Yes. I have a 3.5-year-old of my own who eats nothing but French fries and cheese. So I understand where you're coming from. Sometimes the feeding can definitely be a combination of all three disciplines, because a lot of times what we're seeing is there's a behavior there where they, don't want to eat certain foods. There's a sensory piece because maybe they like really crunchy foods, but you're trying to give them some protein, some chicken, and they want nothing to do with it, or a veggie, want nothing to do with it. And that's more where OT comes from. And then from a speech standpoint, we want to make sure that whatever consistency and whatever texture we're working on with them, that they're able to utilize the oral motor skills that are appropriate to chew and swallow that safely. So a lot of times feeding is that, like, you want all three disciplines involved. I will say that, and I was talking about this with a couple of my colleagues the other day, I've definitely seen more feeding challenges over the past 2 to 3 years. I don't know how much of that is COVID related or just a trend, but being in the field as long as I have, I've definitely seen an upshift in that recently. And it's hard because families are so busy and, you're just trying to make sure they eat. You don't really care what it is at that point. And a lot of us, and I'm guilty myself, will kind of put our kids down and, put an iPad in front of them or put the TV on because we just need to, like, chill from our hard day at work, or we're trying to eat ourselves or do laundry, or, so I think there's a lot of factors that go into it. But what I would suggest is, I mean, I think definitely adding an OT to your team would be a great point person. Um, because again, they're going to look at a little bit of a different skill set than the SLP and the ABA therapist. And I think getting the OT involved and making sure that the three of them are really working closely together and staying in the loop is going to be so important. And then really whatever carryover you can try to do at home is going to be super helpful, because if it's only something that they're doing, while they're in a center or while they're at an outpatient clinic getting their therapy services, if it's only during that short period of time in the week, they're really not going to carry it over, or it's going to be a lot more challenging. So it's tough, and I feel you. I would make sure to get an OT, and like I said, make sure they're all communicating with each other pretty frequently. Love it. Keep working on that AAC. Any other questions? Okay, I think that might be it. This presentation has been recorded and it will be available on our website under resources and under virtual caregiver training. So if anyone is interested in watching over or sharing with anybody, please feel free to do so. You can also reach out and get some contact information for myself or Nicole if you have questions that come up after the fact. But I would definitely say, in whatever setting that you're in and whatever time you're at with your kiddo, whether they are very young and maybe you're, how do you feel about part-time ABA? Nicole, I'm gonna let you take that one.
Yes, of course. So this is a really great question, that part-time versus full-time ABA. I know it's a really big question in the ABA community from families. It's really dependent on the child, where they are, what their needs are, what the long-term goals are. So it can be effective. I always like to, when I've done a transition from full-time to part-time ABA, I really monitor the behavior, making sure that we're still maintaining a reduction of those maybe tantrum behaviors and still seeing a strong enough increase of the other behaviors, just making sure it is appropriate. But you definitely want to find what works best for the family dynamic and what works best for the child. For the best results. So it can work. And sometimes, full-time is needed as well. So it really just depends on the kid. I hope that answers. If you have any other questions with it, go ahead and.
Okay. Thank you for having this one. I'm a CODA, but do not have PED experience, and my youngest son was just diagnosed with autism, so I want to absorb as much information as I can. He is 12. Is there any pointers you can give me? Well, first of all, welcome. I love having some CODAs and some speech and OT blood in here. Let's see. So just diagnosed, he's 12. Okay, perfect. Let's do 12, then we can go back to that. Okay, so any pointers we can give? I would say, in my experience, early intervention is always best. So what kills me sometimes is if a kiddo is even, without a diagnosis like autism, let's say they're 2 and they, are not talking very much, and they go to the pediatrician and the pediatrician says, we'll just wait it out. I'm sure they'll be fine. It like makes me cringe because there's so many resources out there to get help sooner than later. So I would just so much rather, these kiddos get help and earlier rather than just trying to wait it out and losing more time. So I would just try to kind of look at big picture and whoever you're working with in terms of doctors and professionals who made the diagnosis, and see what areas he is maybe struggling with more than another. So for example, maybe he's a great verbal communicator, maybe he's struggling with some sensory things. So then I would maybe prioritize some OT services. Maybe speech and OT wise, he's pretty good. Maybe it's, more some behaviors that he's struggling with. Then I might look into ABA. So I guess I would really just try to work with your team, see what they suggest, and really try to go with that. And I know it's super challenging right now ever since COVID. I mean, wait lists at places are absolutely insane. The nice thing and kind of the silver lining of COVID is there's definitely more virtual and telehealth resources out there. I think for some kids, they're wonderful. For some kids, they might not be ideal, but it's something to at least get you started. And the therapist, the clinician, whoever is involved can help give you some pointers and some coaching behind the scenes to put into place, while you're maybe waiting for an outpatient center to open up a time slot. That's what I would say. I would really try to look at the big picture, figure out what your goals are, figure out what his goals are, and really try to prioritize those and just keep kind of working through it, because there's nothing like, it's just, he learns things differently. And so we just need to find what works best for him and give him the supports that he needs.
And I just want to add a little bit to that as well. I'm not sure where you're located, so I'm not really sure how the school, I'm very familiar with the Arizona school district. So I always say to reach out to the special education department to look at any additional like modifications or supports they can provide within the school if he is going to, a public school. As well as the autism community is very strong, very knowledgeable, very resourceful. There's a lot of different, family groups out there that I know they're more than happy to give their 2 cents on, whatever might be in your local community available to help out. That's one of the things that I like.
Yeah, that's a great point. I didn't even think about that.
Do you want me to address the next part?
Yeah, if you want to, that'd be great.
Yeah, of course. So the question about the social skill opportunities. So the great thing with Bierman, I'm not sure if you're near a Bierman location, is we have a variety of kids, ages and developmental milestone areas and everything. So I do like that model, is that you're able to have that ABA with those social skills. And it's nice because each kid has a one-on-one. So each adult is working directly with those kids to help teach those skills, because even in preschool, kids aren't going to have the skills they need anyway. So now we have more one-to-one with all the kids involved. And we do a lot of kind of like group projects, group art activities, social games and everything, which is really nice. If you don't live near a Bierman, there are also some ABA companies that will go into daycares. So you have to talk with that ABA company as well as that daycare to see if there can be some of that overlap, where you could do part maybe in-home and part in a daycare setting as well. So I've done that with previous ABA companies as well. So there's a few different opportunities, but that's why the reason why I came to Bierman is because they already had kind of that model that allowed me to be in that kind of social atmosphere for the kids.
And even, I mean, I've worked in some in-home speech therapy companies before coming to Bierman, and I know that for some of my younger kids, they did get ABA just from a company that doesn't have in-center. They only do at-home services. It can be tough, and I'm sure Nicole knows that, like, you know, he's 2, he spends all day at daycare, and then to come home and have ABA from like 4 to 7, it's a lot for kids and families. So I think if you can find somebody who's able to, you know, work with him in daycare, that's going to be really helpful. I would maybe work with your pediatrician on that one and see if they have any recommendations. If you know, like Nicole said, if you're not near a Bierman Autism Center. And Adrian, good, I'm glad we could help. All right. Anybody else? Throw them at us. Okay. I think we're good. So again, we just want to thank everyone for coming. I know it's hard on a weeknight, trying to allot the time for something like this. So we really appreciate you all for being here. Please feel free to reach out further if you know, you have questions that come up or you want any more information, and we're happy to help. So thank you again.